Shakespeare once said that the eyes are the window to your soul. Whether you agree or disagree with Shakespeare, most people would agree that vision is a very important part of our day-to-day activities. However, perfect vision is not something that comes naturally to everybody. In fact, according to a survey done by the American Optometry Association, 81% of respondents wore contact lenses, eyeglasses, or both. For those of us who have had to wear glasses in our life, know that most of the time we have to trust our vision in the hands of an optometrist. Today, I'd like to talk about the overall benefits of being an optometrist, the instruments they use, and some of the common eye problems they see on a daily basis. According to the Occupational Outlook Handbook, optometrists make roughly $95,000 a year. To become licensed to practice, they must first obtain a degree in optometry, also known as an OD. They can do this by attending one of the 20 schools across the nation and in Puerto Rico. Second, they must actually pass the federal board's test. Then, depending on the state that they choose to practice in, there may be additional state board tests. Most states require continuing education courses along with periodical renewals of their licenses. In 2010, half of the optometrists that worked in the United States worked in an office that was dedicated solely to optometry. Next, I'd like to talk about some of the commonly used instruments. Optometrist Dr. E. Lawrence Brickfield wrote an article for eyecarecontacts.com that listed some of the commonly used instruments. The first we're going to talk about is the slit lamp. The slit lamp provides high modification view of the front structures of the eye, including the cornea, the iris, and the lens. With help of a condensing lens, it also allows the optometrist to view the retina. The next one I'd like to talk about is a phoropter. A phoropter allows the doctor to test out different types of lenses so that they can accurately see which you see clearer with. This is the part of the exam where the doctor will often ask, is number 1 or number 2 clear? How about 3 or 4? Last one I'm going to talk about is the retina camera. The retinal camera allows the doctor to see inside the eyeball to ensure that the optic nerve, all the veins, and the macula are properly colored and healthy. Lastly, I would like to talk about some of the common diagnosis codes used when prescribing glasses. The first is astigmatism. Astigmatism is due to the irregular shape of the cornea, which is the front cover of the eye. Or it can also be because of the curvature of the lens inside the eye. Myopia, better known as nearsightedness, is when a person can see things up close okay, but have a hard time seeing things in the distance. Hyperopia, also known as farsightedness, is when the patient can see okay in the distance, but has a hard time seeing things up close. All three of these are caused by the light not properly hitting where it should in the eye. The final common diagnosis code is presbyopia. Presbyopia is most common in people over the age of 40. This is oftentimes corrected by a bifocal lens or a progressive lens. The field of optometry is exciting and ever growing. The next time you go to your optometrist, I hope you have a better understanding of how they became one, the instruments they use, and some of the common conditions that may require corrective eyewear. Thank you.